Welcome to Community Watch. Greg will be joining us shortly. He had a little work conflict that he's resolving, and he'll be joining us momentarily. But we are very happy to have with us today. Although the reason we have him, I'm not so happy about, but we'll talk about that. Dr. Gary Voccio, one of our regular guests, perhaps one of our most regular guests these last couple of years. Welcome back.
Thank you. Thanks for inviting me. I'm glad to be here.
Well, let me once again stumble through your job title, which is District Health Director for the Northwest Health District. Is that close?
Correct. That's right.
And you were in charge of is it a 10 county area?
It's 10 counties from Paulding in the south up to the through Alabama border to Dade County in the northwest.
Well, as I was saying to you off the air before we began, I hope we can have a conversation with you soon about something else, but we are talking about COVID today. And I think the last time that we had you on the show, we were in the middle of the Delta outbreak of COVID. So since that has happened, we're into the Omicron experience. And it's kind of a different beast. My understanding, and I guess my question is whether or not this is correct. My understanding is that it is much more contagious than what we've seen in the past, but appears to be less dangerous. But I want to know if that's really the case, because we're seeing so many hospital cases.
Yes.
So what's the truth about that variant?
Well, locally, we are seeing huge numbers, John, of COVID. Numbers we have not seen in any of the initial SARS-CoV-2 virus, or the Alpha variant, the Delta variant, and now what we call Omicron. The numbers are extraordinarily high. And for example, when we had the World Health Organization tell us that we'd like to see, population case numbers of 100 per 100,000 population, which would mean we have this under control, quote. We're seeing in Northwest Georgia, for example, Floyd County, it's almost 3,000 cases per 100,000 population on a 7-day average, which is extraordinarily high. And all of our counties in Northwest Georgia are seeing numbers, granted the smaller counties, but still around 1,000 per 100,000 population in our smaller counties to almost 3,000 in our other larger counties per 100,000 population. Just extraordinary numbers. And yes, it is more transmissible. There's no doubt it is more contagious. It just has more variables on the spike protein that makes it more contagious. Seems to be more of an upper respiratory type of disease than lung disease. The experts think it seems to infect, the nose, the pharynx, more likely than the lungs, although the numbers in the hospitals are some of the highest we've seen. All hospitals in Northwest Georgia are experiencing COVID numbers anywhere from 20% of their population to almost half of the population of the patients in the hospital are COVID patients. And unfortunately, the majority of them are unvaccinated. It used to be around 90%. Now it's about 80% are unvaccinated. Particularly 80% in the ICU, and 90% are unvaccinated who are on ventilators. So this is a disease of the unvaccinated again, but the concern is is so transmissible, and there are so many people getting infected. Just the broadening of the infection is making more people sick and requiring hospitalization. So the hospitals are just full, the emergency rooms are full, emergency room visits are very high. But you're asking about death rate. When you have more people infected, we're going to see more people dying. And we've had over the weekend, around 6 people die of COVID over the weekend by our epidemiology numbers that I saw this morning. So it may not be more deadly if you take a subset of people, but if you infect more people, elderly, for example, or the immunocompromised, just by sheer numbers, we're going to get more deaths.
Well, I was checking the numbers that have been reported in hometown headlines, and I know that the hometown headlines looks at a 5-county area as opposed to the broader area that you serve. But one of the numbers is a statewide number that alarmed me, and that was, and we are taping this, I should let people know, on Monday, January 24th. I'm not sure, we never know what day people will be watching it, but we're taping it on January 24th, 2022. And just since this past Friday, so we're talking about 3 days ago, there have been almost 39,000 new cases statewide.
Yes.
That is just, I mean, why? I don't know. I mean, it's just crazy high.
Yes.
How does that compare to other time periods since it began?
These are numbers we have not seen before. Just alarming numbers in almost all age groups, children included. And that again shows you how contagious this is, and the concern the healthcare providers, hospital administrators, emergency room doctors, what the concern is overwhelming the health system again. Just like I said, 3,000 cases per 100,000 population in Floyd County. It's numbers we have not seen before. Just extraordinary.
Well, I know that I feel like every time we've had you on the show, we've talked about the reluctance that many people have had to get vaccinated, the reluctance or unwillingness to get vaccinated, and that our vaccination numbers lag behind where they needed to be. Is that still true? Is that still the case?
Yes, we really haven't budged much at all in quite a number of months. We're in Floyd County, we're at 44% fully vaccinated individuals in our 700,000 population in our 10 counties. 44% is quite low. And the other counties are lagging behind Floyd County by a few percentage points. Some are in the low to mid 30 percentile range for full vaccinations. And full vaccinations are helpful, but we still would like people to not only get fully vaccinated, but get their boosters at 5 months. We really know that boosters significantly reduce hospitalizations and deaths. It's by a magnitude of about 2, double the effect of just getting 2 shots of a messenger RNA vaccine and then a booster. The booster is extraordinarily helpful in prevention of hospitalization and death. You still may get COVID even if you have a vaccine and boosted, but it will be more or less a mild event. You won't need to be hospitalized or placed in the intensive care unit. They do help, and we're just lagging quite behind the state and the country in general. 44% in Floyd County is relatively low, and the other counties, like I said, are behind Floyd County.
Well, I know the timing has changed a little bit since we began with the vaccination. So for individuals that are getting their first shot now, how long do they have to wait for the additional ones?
Well, for your first Pfizer or Moderna, you wait 21 days or 28 days respectively. And then 5 months later, you get a booster. It used to be 6 months, but we realize now that 6 months is not is too long a period of time for your immunity to remember a response adequately. When they test people and check their what's called neutralizing antibodies, after 5 months, it seems to wane significantly. So now that is why it was changed to 5 months after you've completed your 2 initial shots of Moderna or Pfizer vaccine.
Well, I know we talked about this before, why individuals are choosing not to be vaccinated. And I know previously we talked about, some really crazy stories that were out there about the vaccines and about alternative options other than vaccinations that people were considering. But we're still saying that the vaccines are safe, that they are truly saving lives. And that's correct, isn't it?
Oh, absolutely. And thank you for bringing that up. Our health department nurses last year gave over 200,000 vaccines in Northwest Georgia. We did not have a single adverse event that I can recall or reported to me from any of our vaccines. We had one anxiety attack, and that does happen. Of course, people are afraid of needles, but there was no true medical adverse event from 200,000 vaccines that our public health nurses gave last year. They do save lives. They'll keep you out of the hospital and keep you from getting on a ventilator or even dying. In the country, there have been millions of vaccines given. The concern, of course, is one concern for myocarditis in young men, but the largest study on that was very self-limited, lasted 2 days. No one required hospitalization. Excuse me, the people that required hospitalization, it was a 2-day event, and they had no further adverse effects from the vaccine. So the vaccines do work. We're not going to track you. There's no, not going to change your DNA or RNA. It's not going to make you impotent. It's not going to disable you from getting pregnant. So the side effects can happen, but they are extremely rare, as opposed to the side effects of COVID itself, long COVID, or even dying from COVID. Those events are much more frequent than the side effect of the vaccine.
Well, we have come up on our break time, our midway break. So we're going to take that break and we'll be back with much more with our guests. So don't go away.
I know you've had your moments of doubt and struggle, and I'm here to say I'm proud of you.
And although each one of us may take a different path, may we look back upon today as the moment we stepped into a larger world, a greater world.
You will pass this way but once. Do it right.
If ever there was a time to follow your passion and do something that matters to you, now is certainly that time.
Welcome back to Community Watch, and we're having a conversation with Dr. Gary Voccio about the current COVID situation. And once again, I want to remind folks that we are taping this on Monday, January 24th, just to give you an idea, depending on when you watch it. And we've been joined by Greg, who is taking care of his work issue. And welcome, Greg. Good to see you.
Good to see you, Doc. I'm sorry I missed the first part. You know, I'm always interested to learn about what's going on with COVID-19.
Well, in the first half, Dr. Voccio gave us the solution to the entire pandemic. So
And
we
you missed it.
I
I wish that were true.
had to watch the show from the beginning.
Well, Dr. Voccio, I did want to get a sense from you, if you can, to tell us when this current Omicron surge is likely to wane, and because it's COVID has given us a number of surges, and then in between there are periods of slower infection.
Yeah, that's the million-dollar question. In Georgia in general, some of parts of the state are showing signs of decline in the Omicron variant. And by the way, almost all of the COVID-19 virus we're seeing in Georgia and throughout the country, but Georgia in particular, over 99% of it is the Omicron. When the CDC does the testing, random testing, we're seeing all Omicron. In parts of the state, there has been a decline in COVID cases, but not in Northwest Georgia, unfortunately. Our numbers are going up. But they are coming down in most age groups, except for the K through 12 age group. Those numbers are still climbing. And that's probably because those kids are going back to school. So those numbers are climbing. The remainder of the numbers in Georgia are coming down, but not in our 10 counties in Northwest Georgia. They continue to go up. The CDC modeling says that we're going to still be in this for the next couple of weeks. We are seeing declines of Omicron in the Northeast and in the Midwest. They're coming down. So there may be a light at the end of the tunnel in the next couple of weeks, but we'll just have to wait and see. But that's just preliminary data right now. And we'll see if we get another variant. We don't know, of course, but this has been the worst we have had.
My sense, being out in the community, is that people are largely ignoring the pandemic.
And I think it's called COVID fatigue, but actually I was surprised. I was in a courthouse recently. I'm not gonna say which county, and no one had a mask on, not in the court. I mean, the judge, the lawyers, no one had and it was a small courthouse, a juvenile courthouse, and no one had a mask on. And I was just thinking, my goodness. But I agree. I think the fatigue has set in, and then you have things out there that is people are saying this variant is not as it's not as strong or it's not as deadly. And so I just think there's a lot of information about the Omicron variant. And so I think that coupled with misinformation, I agree 100%. It seems like people are not as concerned with Omicron.
I agree. I think people are just fatigued and tired of dealing with it. But I said earlier, Greg, before you joined us, that this is much more transmissible, much more contagious, and just by sheer numbers, we're seeing more people in the hospital than we've seen since the pandemic started. And we're seeing people dying. We had, I think, around 5 or 6 people die over the weekend from this virus. Mostly older people, of course, elderly. And those are the people we have to protect. The people with immune compromised states, people on chemotherapy, et cetera, steroids for whatever reason, and the elderly, elderly over age 60, 65. Those are the people who die of this, and those are the people we need to protect. Most people will tolerate it. short to live. The average Omicron syndrome is about 3 to 4 days. It's more upper respiratory, but it's killing older people and people who are immunocompromised. Those are the people we need to protect.
Dr. Voccio, I'm always concerned with everyone in our community, but I'm always particularly concerned about the African-American community. I know with the Delta variant and originally COVID-19, African-Americans lagged behind in vaccinations. Where do we stand as a community in Northwest Georgia and as a nation, if you know, in terms of African-American vaccinations?
Well, in Georgia and Northwest Georgia, African Americans are the least population demographic to be vaccinated. It's about 41% in Northwest Georgia. Hispanics are at 42%. Whites are around 50%. And the population that gets vaccinated the most are the Asians. They're well over 80 percentile, no matter where you look. But African Americans still lag behind the entire population. And we've talked about this before. There's history behind that. And we just have to convince all people, no matter who they are, that a vaccine and a booster will keep you out of the hospital and probably save your life. Or if you get COVID, it'll be very limited and you won't be as contagious or transmissible. We know that people who are vaccinated with a booster will be less likely to get COVID, but if they get COVID, they'll be least likely to be transmissible. Their viral load will be less, and it'll be less over time to transmit it. So that dual effect will reduce the transmission throughout the community. And we just need to convince people that these vaccines are safe. And that's the hardest part we've come against, is convincing people it is safe. We're not trying to harm them, we're trying to help them.
That leads me to another question. In one of the discussions that I'm involved with COVID, I heard a doctor say that the Omicron variant isn't that it's less deadly. He just said that quite a few people that have gotten Omicron are boosted or had vaccination, so it's less for them. But people that are not vaccinated, he said it's just as dangerous for those people that are not vaccinated as any other variant. Is that true?
It seems initially, Greg, that we weren't seeing the fatalities we saw with the other variants. But what has happened is, because it's so contagious and has broadened its infectivity throughout the population, it's infecting more people. And now we are seeing more deaths right now with the Omicron variant, because it's infecting more people, which, when you consider only 40%, a little bit, around 40% of the population has been vaccinated. Granted, maybe 10 to 20% of the population has had previous COVID. So you're talking about maybe 50% of the population in some form or fashion having some immunity, but that leaves half the population without it. And when you have that number of people without an immunity, you're going to have a contagious virus like the Omicron. People are going to die. And you know what? Why take the chance in getting COVID and getting an immunity that way when you can get, 2 relatively easy shots and a booster and keep yourself out of the hospital? It's just an argument we're trying to win.
Let me ask a question about testing, because my sense is that there are quite a few folks who, when they are catching COVID, it has the symptoms, especially if they have a mild case, it has the symptoms of perhaps a bad cold. Should individuals be getting tested when they get sniffles? I mean, should any of those symptoms encourage people to get tested?
Yeah, if it is cold and flu season, yes. Cold and flu season, the overlap with the symptoms are very similar to the current Omicron. And yeah, if you feel sick for, 24, 48 hours, and you have any other associated symptoms, fever, just aches and pains, yeah, I would certainly get a COVID test. I certainly would, either a rapid test or a PCR. Go to one of the health department centers, Catoosa Fairgrounds or Voccio or, Catoosa at the Colonnade. Yes, and get tested. You don't want to spread this to anyone susceptible who really may end up in the hospital. And that's the reason for getting tested. You can get a rapid test and do it, and they're fairly accurate if you're symptomatic. If you're not symptomatic and get a test, the inaccuracy is about 20% false negative. But if you have symptoms and they're lasting an inordinate amount of time, 24, 48 hours, and if you have this associated symptoms, yeah, get a test. It's probably COVID. We have had some flu, no doubt about it. We're in a high flu range right now. We do have a handful of people in the hospitals with flu. So get a flu test too. Could be one or the other, possibly not both, but get a flu test too.
I believe that the CDC came out with an acknowledgement that the cloth masks that people are wearing are not as effective as some of the others. So for those of us who are wearing a mask, we need to be careful about what kind we get.
Well, there have been studies now, and the CDC is way behind on this. I was just flabbergasted by this, to tell you the truth. They are way behind. There have been some very elegant aerosol studies done last year. They're over a year old now, by the University of Central Florida, engineers there, that well-published data demonstrating that cloth masks aren't very good. If you put a surgical mask on, which is a tri-ply electrostatically charged mask, and put a cloth mask over that, that's good. Simple mask like this is of benefit, or even a N95 mask is the best. But cloth masks aren't very good at all. And the reason is that they don't have the electrostatic properties. They're woven in gaps that the virus can easily aerosolize through it. They have gaps on the side. So the cloth masks aren't very good at all. You need to get an N95, which, by the way, if you purchase one, they are good. Make sure they're fitted well. But the true N95 masks are fitted by professionals for medical professionals in the ICUs, et cetera. There's a very intricate way that they are fitted to people. The true N95 fitting is laborious, takes time, but you can get one of these type of N95 masks non-fitted. They're the best that you can do and prevent people from spreading COVID.
Well, Dr. Voccio, we're out of time, but I appreciate so much you talking with us, and
you're welcome.
Folks should get vaccinated and boosted, and they should still be wearing masks, and hopefully this will improve soon. But thank you.
You're welcome.
See y'all next time on Community Watch.
Right here. Take charge of your future at GHC. Apply now at highlands.edu.